today what we're going to talk about with a really wonderful panel is what we're going to talk about is kind of almost the secret sauce of innovation. Basic researchers with leaders from academia, government, and industry. And in this panel, I'll be speaking with Joe Alexander, who's director of the Medical and Health Informatics Labs at NTT Research. Welcome, Joe. Juan DePablo, who's on the end, who's the Executive Vice President for Science, Innovation, National Laboratories, and Global Innovation at the University of Chicago. And also Al Alamandi, who's the former Program Management at DARPA, and also President and CEO of a firm called Palantir.
Thank you.
So welcome. Let me grab my notes out here, and we can get going. So we are here to discuss really this idea of fundamental or basic research and its role or importance for helping create novel solutions and spurring innovation. And I wonder, to help everybody get a sense of where you're coming in from the directions, I wonder if you can just talk a little bit about your background and how you really look at this idea or two of what your current role is and how it plays into this idea of fundamental research. And Joe, I wonder if I can start with you, please.
Thanks a lot. So I grew up in Alabama. I went to Auburn University to study chemical engineering, then decided to go to Johns Hopkins for an MD and a PhD degree. Did a couple of postdocs, one at Albert Einstein, one at Cuse University before joining the faculty at Vanderbilt, where I stayed for probably about 8 years. Went to the pharmaceutical industry and found my way here when I heard the word biodigital twin. As an engineer, I mostly consider the work I do as applied science, if you will.
Okay.
There's a computational cardiologist at University of Auckland named Peter Hunter. I accidentally met his brother, Ian Hunter, who's a chemical engineer at MIT, and he told me about their backgrounds. And he said that when they were children, they were always building things and taking them apart. And he defined science, I think basic science, as taking things apart, and engineering, applied science, as putting things together.
Okay. So
with the biodigital twin, I think we're practicing more engineering.
We're going to hear about this biodigital twin in a little bit, aren't we?
Yes.
Okay, wonderful. And Al, I wonder if I can trouble you to also give a little bit about your background.
Yeah, sure. Thank you. So my name is Ali Mundy. I am an electrical engineer and a neuroscientist. I really started my career in electrical engineering and had worked up at the Air Force Research Lab for a while, looking at new technologies for radio communications and software-defined radio. The first time we realized that you could actually program a radio to do different things, and one radio could be 5 radios. And that was really important for folks that are flying, you know, the fighter jets and so on, trying to figure out how do you get real estate in a cockpit when you have so many radios there. And if you have one radio do something depending on where you are on the mission, that was important. So that was maybe the first 15 years of my career. And then I decided to, we started getting interested in AI, started getting interested in neural networks at that time, went back to school, got my PhD in neuroscience.
Okay.
And so at that point, I went down to Charleston, South Carolina, where I became the chief technology officer of a Navy laboratory down there. Where I headed up the whole S&T group along with the discovery invention portfolio. So we were looking at new technologies and how to get them into the Navy infrastructure and translate technologies from basic research all the way through advanced research. And then recently, within the last 5 years or so, 6 years, I had the opportunity to go up to DARPA, which is where my two worlds kind of came together, right? Where my engineering background, my neuroscience background, that was the opportunity to try and bring these things together and really advance some thinking in neural interfaces and what's possible on how do you connect to a your neural system, peripheral or central nervous system, and mainly for recovery of function, right? So war fighters that were coming back from Iraq and so on that have had amputation, PTSD, spinal cord injury, is there a way that you could tap into the human body, connect to the nervous system, and restore function that was lost? And so the last 5 years of my career in the government was focused on that.
Okay, my goodness. All right. I can't wait to dig into some of your thoughts on this as we go in.
Thanks.
And Juan, if I can trouble you for your background, please.
Yeah, thank you, Paul. I am Mexican. I grew up in Mexico City, And I went to school in chemical engineering also at the National University of Mexico. And in Mexico, it is not uncommon to work while you're going to school. And I was working with the oil industry. And that was very impactful for me because it led me to decide that I did not want to spend the rest of my life working in the oil industry. And I decided to go to grad school. I went to Berkeley to pursue a PhD in chemical engineering as well. Here in Berkeley, I studied primarily thermodynamics. And at the time when I was going to school, some new ideas were emerging on how to use supercomputers to simulate molecules and atoms and electrons directly. So I thought that's what I wanted to base my career on, and that's what I've done for the last 30 years, really develop the algorithms, the methods, the theories that allow you to predict the properties of complicated materials on the basis of electronic molecular interactions. I went to the University of Wisconsin, where I was for 20 years doing all this work in science. And then 10 years ago, I was recruited to the University of Chicago to establish the first engineering school at the University of Chicago. I was the first hire for that program. It's a very interesting school. It's a program that is actually not based on traditional engineering disciplines, but it is based on problems, challenges, where you bring in the best experts in multiple areas to solve problems that are just facing humanity. So we have a program on immunoengineering, for example, that is very successful. We have a program on quantum engineering, again, very dynamic, very innovative. And then we have a program on materials for energy and sustainability, which again is addressing issues of healthcare, as well as issues of climate, energy storage, and so on and so forth.
Okay, fantastic. Well, we did talk a little bit, and Joe gave his perspective a little bit on the difference between basic and applied research. And I wonder, Al, if I can ask you the same question. Help us understand and get on the same page. What is the difference between basic and applied research? And in your perspective, why is it so important?
Yeah, so in the government, there's something what we call RDT&E, which is research development, testing, and evaluation.
Okay.
So when you think about the whole spectrum of technology, starting from basic research all the way out to where something's being fielded, right? And in the field, that there's a lot of testing and logistics and so on that have to go into play to maintain that. So when you look at the president's budget and you look at how funding is allocated to different areas or stages of research, from basic research, then the basic research, like to me, is fundamental research where you're not quite sure where that technology might be applied. You don't know what the product might be. You're not quite sure what it is, but it might be some unique material that may have some promise. And you start playing with that. And then at some point in time, you say, well, I might be able to use this in some application. And it's early thinking. And at that point in time, you kind of move from basic research to applied research. And in applied,
where does that transition? How do you know it's time to transition?
Yeah, it's a gray area, right?
Okay.
It's a gray area because a lot of times, you're always thinking as you're doing the research, well, I wonder if I could apply it here. And once your story gets strong enough, and then you can basically go for the next pot of money because there's certain pots identified for certain areas of research. So you kind of have to know roughly are you at a point where you can make an argument that you're moving from what we call 6.1 to moving to 6.2.
Okay.
And then when you're in that field, then you're pushing the technology forward. It looks like it might work, and now you want to actually advance it, which is the next stage. So it's basic, applied, advanced. When you advance the technology, now you're in what they call 6.3. And in the 6.3 funding area is now you're saying, okay, I think I can apply it to this given product.
Gotcha.
And actually start making some prototypes and demonstrate it in the lab. And that's the definition of advanced technology, is that you have a prototype that you can show. It may not be in the field, but it's in a field-like environment.
Okay.
And then you move from there. And so and different organizations are funded with different types of money. So you kind of have to know when you're writing grants or so on where you're going, what is it you're trying to apply for? Is it basic? Is it applied? Is it advanced? Where is it at?
Okay, excellent. Does that kind of line up with your track on basic and applied research one?
It's actually very different for us. I think in an academic setting,
okay,
the gray area that you alluded to is even grayer. It's diffused. And I think in an academic setting, basic research is research that you pursue just for the sheer interest of it. You want to answer questions of nature that in your mind require an answer. And the motivation is just curiosity. There's nothing else. But at the same time, I think that it is important for scientists to realize that you have to be thinking about the impact that your research can have, whether it be in medicine or in technology, in communications, in computing. Thinking always about what your research might be useful for is a very, very good thing. In recent years, I think we're seeing a change in the incentives that are available to motivate scientists to think about the outcomes.
Who's changing it?
Well, I think society is requiring that.
Okay.
I think scientists themselves are starting to appreciate more and more the benefits of having impact, not just through publications, but changing the lives of others. And then, of course, very importantly, the federal government, where increasingly we see programs that try to integrate the fundamental basic research aspects of science with the translation and, again, the workforce development and other aspects of impact. So that's really causing tremendous changes, and I think they're very healthy. I think we're shortening the time that it takes to take a discovery to a product, and that benefits everyone.
Okay, so please, I was going to ask you.
On this topic, Neil deGrasse Tyson tells a joke about how to produce more milk from a cow. And he says that if you're in animal husbandry, you consider the cow's diet. If you're an engineer, you think how to make better milking machines. But the astrophysicist will ask, will say, please consider a spherical cow. I would say that the first two cases would be applied science, and the last case would be basic science.
Okay. So we from the government side, the academic side, and you've been on both, how do you think of it from the industry side? How it's not all that common, I guess, anymore to have industry involved in basic research, is it?
To be honest, the reason I left Vanderbilt on the faculty doing more basic research is because I found myself training to write grants more than doing the actual research.
Okay. 6'1" or 6'2" or 6'3"?
Right? Yes.
Yeah. Okay.
All the above.
Yeah.
So I wanted to do something high impact, and so I went to industry.
Okay.
And it turned out that I got very good funding in the pharmaceutical industry for doing research. Partly because there were groups that were running out of budget by the end of the year that they had to spend.
Okay.
And I always had a project in my back pocket for modeling and simulation.
Okay.
In fact, Roger Edwards, I see him sitting out here, he and I did some work also with Argonne National Laboratory on agent-based modeling and simulation. So I got very good funding from industry, pharmaceutical industry,
Okay.
With respect to basic science and more applied science.
But that's on the pharma side, right? And what about other fields?
So my entire career, except for academia, has been in the pharmaceutical industry, so I can't comment much beyond that, except that my only government employment personally had been with the VA. As a physician, I was sworn in at the VA for a bit.
Okay. Let's talk a little bit more, if we can, about how funding is breaking out. And we do notice, of course, that there's always discussions of how money is being spent. Is it enough? Is it too much? How does funding break out today, when you think in the U.S. anyway, for industry funding or academic funding or government funding? Is it going up? Is it going down? Staying flat?
Well, I can tell you at least federal funding for research is going up.
Okay.
The last several years have been very healthy. We've seen steady increases. I think those investments are paying off big time. Now, there's always a question of, is that sufficient? And
Is the amount sufficient?
That's right.
Okay.
And my answer would be, as great as these investments are, it is not. We're at a time of great challenges that require additional investments, great opportunities that you don't want to miss out on.
Okay.
And any investment that we make in science right now will translate into incredible revenues for everyone. So it is money well spent. And again, I think we'll do with more.
Okay. So Al, defend the government here, would you?
Well, actually, as one was talking, I'm thinking to myself, well, there's efficient and there's efficiency, right?
Okay.
And so on the government side, there's and I think on the government side, it is going up as well. I don't know about the services. I didn't look at that data, but I know that, the DARPA budget is up. And then ARPA-H just recently stood up, which is huge, right? I mean, this is a big impact for healthcare.
Right.
To look at transformational moonshot ideas that basically wasn't necessarily being tackled by NIH specifically. And so I think, there's clearly funding there that was never there before and was allocated by the president. But I remember in many cases, in all the positions I had in the government, there's a lot of discussion about is the funding is sufficient or efficient, and is it, and are you managing it efficiently? And there's always this question about, at least I found in basic research, is there's always a question of how to defend it, right? Especially in basic research, when we're saying...
When you say defend it from what?
Defend it from the argument of you have either too much or too little funding. How do you make the argument that I need more? Or how do you fend off the argument saying you have already too much? And so there's ultimately a question about, well, how efficient is your research? And is what you're doing effective? And that's an interesting pathway to go down, right? And it takes a lot of technical evangelism, right, of somebody over the science. There's the scientists that are working on what it is that needs to be worked on.
Right.
But then there's another layer on top of that, which tend to be scientists. It was a position I found myself in often, where it's not defending the science, but it's about putting the science in context, about what could happen if the science is successful. Here's the impact that it can make in the United States, and in my case, for national security.
Right.
Right. And you need another layer of evangelism on top of the science to help defend those that are asking.
Who's typically the evangelist in those cases?
And usually the program managers.
Okay.
In the case of DARPA, when I was there, you're fighting to get a program off the ground. But once you get that program off the ground and funded, and you have teams working on that effort, you're a team. I want to see those teams succeed just as much as they want to succeed.
Got it.
And so I need to defend that program. Right?
Okay.
And maybe research doesn't quite go according to plan. It never does.
Especially in the basic research.
Exactly. But there needs to be somebody there that says, this wasn't the goal we achieved, but look what we can achieve. And being able to tell that story keeps confidence in the research, which then therefore ties back to the funding that's coming in.
Great explanation. Great explanation. How about from your perspective in industry?
Well, less from industry, but from academia, this discussion has brought back some uncomfortable feelings that are not unrelated to my earlier comment about why I left academia, which is that you had to struggle to get NIH funding, and it was usually not enough. And I think the process stifled innovation, and this is government related as well, I suppose. It stifled innovation because you kept working on the things that you had a history of having worked on in order to justify getting additional funding. And so you didn't want to deviate too far from your known or recognized area of expertise. And you wanted to get that 10-year slot position and those things. And so you were kind of stuck in terms of innovation. It's difficult to jump out.
There's been studies done on that, of course.
Yes.
And it's really quite remarkable, isn't it?
It is.
Yeah.
And so I'm excited about DARPA, ARPA-H, those kinds of opportunities that look for the moonshots, as Al was describing.
And then funding, and I think it is, we heard Kazu talking, funding here is about 3%, and that seems, a pretty healthy amount on the R&D side. So I imagine in a number of corporations, they're trying to figure out how to make a big impact, but on the whole basic funding side.
That's a good point. Yes, I agree.
Okay, excellent. Joe, I wonder if I can just come back and really talk. You lead the medical and healthy informatics lab here at NTT Research. And I think you talked a little bit about this, but this idea of having a vibrant academic career and pharmaceutical career, and then deciding there's things that I want to do differently, not just funding-wise, but I want to come into industry to do it. What were the deciding factors that led you to that, besides easier to get grants?
In terms of vibrancy, it's too low for a high praise, too brown for a fair praise, and too little for a great praise. But once I was in the pharmaceutical industry, able to do research, I was doing two jobs. I was doing my regular pharmacy pharmaceutical industry job, which was medical affairs. And then I had this money in my back pocket to do modeling and simulation, which is what I've always loved as an engineer. But I was always seen as that strange guy who was off doing something else. Then after about 20 years at Pfizer started something they called Organizing for Growth.
Okay, at Pfizer?
At Pfizer.
Okay.
Which is a euphemism for cutting down the size of the organization. And they gave me a package I couldn't refuse.
Organizing out for growth.
That's right.
Yeah, gotcha. Okay.
So then I left Pfizer, hung out for about a year, and I was offered another job at Merck, which would have been my second round at Merck as head of medical affairs for heart failure. When I was invited out here by Kazu and Ray Ellen and Dr. Tomoike, and Kazu said, "Biodigital twin," and that did it for me, because it was all. Was
that a common term at that point?
No, at least not in my spheres. It was common in the aviation, commercial aviation industry, of course, and they pioneered a lot of the work. But the notion of spending all my days doing modeling and simulation with a kind of moonshot of achieving something that hasn't been done in the way that we could do it, and hooking up with John Peterson, yeah, it was great.
Okay. Now, let's go back to this idea of moonshot, and especially the challenge of doing moonshots, if indeed they're incremental goals for funding purposes. Mm-hmm. How do you think about moonshots, and maybe how do all of you guys think about moonshot goals?
Well, I think Al has the best definition. He's thought about it. He worked in an area that was focused on moonshots. For me, a moonshot is the kind of goal of someone about whom you can't quite decide if they're suffering delirium or lofty intelligence.
And that's fair. Okay. That's a good definition.
And it may take a few years to figure it out.
Okay.
But I think the common theme, at least from my perspective, is that there may be a chance to pull this off, given the right scientists, given the John Petersons. But at the same time, you may have to realize that those scientists able to do that may no longer be living.
When it hits?
No, they're past scientists.
Okay, yeah.
Some of the great minds, the Newtons and so forth, might have been the ones who could have pulled this off, and we can't. It's just a realization that the moonshot is not necessarily achievable. Now, the first time I used the phrase moonshot, I really was thinking that what we propose, especially for autonomous closed-loop therapeutics, was moonshot, but now, after several years of work, I can foresee it.
That's amazing.
Yeah,
okay. Do you mind if I push a little further on some of your work, and we'll come back to some of these other guys, but I'd love to dig in a little bit about this whole idea of developing a cardiovascular biodigital twin. And I wonder if we can talk about what that actually means, mm-hmm. and why it's exciting to you, and where do you think the innovation's coming from?
Well, as we began to build the concept within our group, and I have a group of we have 8 talented people, then we started from the example of commercial aviation.
Okay.
The fact that engines on planes collect all this information while they're flying and download it once they're on the ground if they don't stream it from the air. And a model of each engine is running on the ground in simulation, so that when the engine needs maintenance, you already know from the simulation, and so that's predictive maintenance of an airplane engines. And then you can combine information from various engines. So we thought about cardiovascular care in the same way, that we collect this information, we make sense of it, we build a model, and we tend to use electrical analog models. We build a model of a particular person, and as we get more information about that person,
what does the model look like? Is it an actual person?
No, it's a
heart
collection of electrical analog circuit type diagrams.
Okay.
That have value and insights that, in my opinion, mostly came out of Johns Hopkins, where John and I, we both trained. And we got some of the experts who came up with some of the concepts to consult with us, Professor Kenji Sunagawa. And the type of a model that we're building, there's no one better qualified to build it than the people that we happen to have.
Remarkable.
So it's a model that will be computationally efficient, no more complex than it needs to be to represent all of the systems necessary to ultimately automatically treat acute heart failure and heart attack.
If I can ask a little bit more, tell me how it's looked at and studied today, and if you say, here's what I hope to do differently in the future, what's the distinction in the gap?
Right now, we built, led by John Peterson, a general model that's based on animal experiments.
Okay.
We need to, because the circulatory system runs through various important organs, not the least of which is the brain, the lungs, the kidney, we need to represent those systems in more detail, neurohumoral control, various baroreceptor reflexes and so forth. And we need finally to make the translation, often called allometric scaling, from animals where we prove the concepts into humans. I should have said from the beginning that our approach is fundamentally causal in nature because physical laws apply to everything, and anything that's not covered by physical laws is just a matter of opinion. Some matters of opinion are more important than others, and we recognize that. So we're also building platforms that provide for causal inference, Bayesian inference, ways to infer things in humans that cannot be directly measured.
Okay.
So this is how we see the future. Going most immediately for something I referred to earlier as autonomous closed-loop therapeutics is like the self-driving car, but this is self-driving treatment.
Amazing. Okay.
For acute heart failure and heart attack.
How do you know that there's a there? When do you look at it and do your colleagues say, this has accomplished what we set out to do?
The reason I have so much confidence about autonomous closed-loop therapeutics is because we are very close to achieving it in animal preparation.
Okay.
Then it's a matter of translating to humans, and we made some agreements with the National Cardiovascular Center, Kokuritsu Junkankibyo Center in Osaka, to be able to, over the next 5 years, move to taking advantage of human data, invasive cardiac data that's brought to National Cardiovascular Center from all over Japan, and be able to test these models and test the notion of scaling from the animals to humans and what we just established as a biodigital twin center at that institution.
Okay, amazing. I'm going to hit you with one more question, and then I'm going to get you off the hot seat. But I do also want to hear a little bit about this whole idea of organ on a chip, science and technology.
Yes, organ on a chip is a common phrase. What we're doing is actually more of an in vitro preparation. I don't know if Kit Parker is here, but in the back, that's work that's really science as opposed to engineering, because what Kit's able to do is to take human stem cells, differentiate them into cardiac myocytes, and then build miniature hearts, miniature ventricles to study fundamentally the right ventricular, left ventricular interaction. And at the same time, we have labs in Munich that are developing various bioelectronics and special chemistry applied so that certain new materials are able to be conformable, conduct, and stimulate. And we hope to hook this up to the work that Kit Parker is doing. And so what we would call that finally is an in vitro cardiovascular biodigital twin. So a very small scale representation using a person's own tissues.
Amazing.
And so that's patient-specific as it gets.
All right. You're explaining out the whole idea of basic research, engineering research, science research. It ties together just beautifully. So thank you for explaining it that well. Juan, let me skip over Al just because I want to dig in a little bit more on the academic side of things if you can here. You have a lot of roles at the University of Chicago, but I want to focus on your role as EVP of Science, Innovation, and National Laboratories. And I wonder if you could, as you mentioned, you've had a role, continue to have a role as a professor and a scientist, but you've evolved. And I'm wondering what it was that wanted you to evolve into taking on some different responsibilities and what opportunities you saw.
I think the evolution is very simple. I think I've been given incredible opportunities by my mentors before, by people who helped me really. And you get to a point in your career where you need to start helping others, the younger generation, etc. And without realizing it, all of a sudden you're doing more and more administration. And you enjoy actually helping others. So that really sucks you in.
Okay.
And it becomes challenging. You need to balance your own research interest with your administrative responsibilities. But as long as you can do that, I think it's fun to be able to do both.
Okay.
Really
early on, I think when Niall was giving some of his explanation, you said, well, it's different in academia. And I wonder if you can go into a little bit more detail about what you see as the role today and tomorrow of research universities when it comes to basic research, and how it complements what's also happening in academia, in industry and in government.
Well, first role, of course, is education. Universities train, educate the next generation of scientists.
Right.
And for that to happen, you need to have the best faculty and the resources there to train these scientists and engineers. So they play the most fundamental of roles in that ecosystem. Universities professors have tenure, which, as long as they're doing good work, gives them the ability to pursue the crazy ideas. Those ideas that might result in the next quantum computer, the next transistor, and having that freedom, I think, is a bedrock of innovation, really, because that's where it all begins. So that's the key role. There's others. We're increasingly working on translation, entrepreneurship by partnering with business schools, schools of economics.
Right.
All of that is very important. The intersection between policy and science is becoming increasingly important, and that's.
But tell me what you mean by that.
Well, for example, climate and energy.
Okay.
We might come up with the most incredible solutions to store energy or to use alternative energy sources. If those technologies are not backed up by policy, right? By government
it doesn't go anywhere.
That cause it to be embraced. It doesn't go anywhere. So you really need to work at the interface between economics, policy, behavioral science, and technology.
Okay. You talked about at the beginning that you came to the university to start an engineering program. That's kind of late to the game, right? And how did you come into that and decide to approach it?
I think that it is rare in anyone's career to be given the opportunity to start a new school, a blank slate, and to create a school according to whatever you think is a reasonable new way of thinking. To do so at the University of Chicago, which is a very serious institution, is a double whammy. Really, to be at a stage of your career where you have something to contribute, a blank slate, and a school behind you was just extraordinary. And the growth of the school, what we've been able to achieve, is just incredible. So it was the best decision of my life to do that. Yeah.
Now, you also oversee the national labs for the university, and I wonder if you can talk to us just first a broad picture about what are the national labs and what role do they play in basic research in this country, and how do they work with both industry and government?
So the national laboratories are a complex of very large laboratories operated by or owned by the Department of Energy. And they cover a spectrum of mission-driven research that encompasses energy, biology, computing, artificial intelligence, quantum information sciences, and so on and so forth. There's almost 20 of these national labs throughout the country. The ones that I oversee are Argonne and Fermilab. And it is interesting to think about Fermilab right now in the context of moonshots. You were talking about what a moonshot is, etc. I think the process of how you achieve a moonshot is very, very important. A moonshot can be, let's cure cancer in 10 years. And the way you might go about it is by funding 100 laboratories, give them money all, and you tell them come back with an answer. one or two of them might come with an answer. But what is done in the other 99 labs might be lost. We don't know what it's going to be. A moonshot at one of these national labs, a moonshot in physics, is very different. It might be, let's measure how a neutrino decays into another elementary particle. And to make that happen, you need to get 2,000, 3,000, 4,000 scientists around the globe to each work on a little piece of the instrument that you're going to build to make that experiment. It takes you 10 or 20 years to design and build the instrument. Everybody doing their own little thing. And at the end of the day, when you turn it on, it works. It's just incredible, right? So that's a moonshot where everybody does their piece, and every piece actually works.
Okay.
And many of the technologies that you develop in the process benefit humankind. For example, RF cavities, superconducting cavities for supercomputers, for quantum computers, were developed when we built the accelerators for these experiments. So all of these byproducts work because of the way in which we implement the moonshots.
Okay. If I can ask you just one final question here. Let's talk about industry partnerships in academia. How do they work today, and how do they best work when they're going well?
I think they work in any number of ways. I think industry realizes the importance of these partnerships. Access to the talent that you have at universities is very important. I think it is important for industry, to the extent they can, to be embedded in academia so that they actually understand.
What do you mean embedded?
Well, perhaps being part of a laboratory at a university where you're watching science as it happens, all of these developments, and you're helping your academic colleagues connect the dots between applications in your company and what you're doing for basic reasons, right? I think the model of industry academic partnerships is evolving. It's evolving for the better very rapidly, where you have more scientists embedded at universities. You find examples of joint appointments where professors are 50% at a company, 50% at a university. You find more students doing internships in industry, and I think that's really helping everyone. Where challenges remain, of course, and as you would expect, is, for example, in IP management, where everybody wants to own the ideas, and you need to come up with a compromise where everybody wins. But as being worked out, getting better at it. So.
Good. Thank you. Great explanations. Al, if I put you in the spotlight here, right in the middle, if I can. I want to talk. You do have a role of partner strategy here at NTT, but also I really want to focus a little bit more on your time at DARPA. And this whole idea of developing a brain-computer interface, and that it doesn't have to be surgically implanted. Talk to us about that, and where did that all come from, and what were you doing on it?
Yeah, the idea. One thing to think about is from DARPA's perspective. We were talking a little bit earlier about different types of research and basic research and so on.
Can I just, in case, make sure everybody knows it, can you explain to everybody what DARPA is?
I'm sorry. Yeah. So the DARPA, for those that aren't familiar with the organization, is called the Defense Advanced Research Projects Agency. And the agency was formed after Russia launched the Sputnik satellite in 1957. And when that satellite went up, it surprised us. We didn't realize that technology existed. We weren't quite sure what to make of it. We knew that there was an impact of having something in space and how that might affect national security for the United States. And at that point, the government decided that we will no longer, or should never, be in a situation of technology surprise. So they invested in an organization to push the very edge of what's possible, and to make sure that we understand what technology can do, and to explore this very edge of the possibility of technology.
Great.
And that's what the whole organization was created. So anything that comes out of DARPA needs to be transformational, not incremental. If it's incremental, and that's where the term moonshot comes from, right? And so as I said to Joe before, when you're in DARPA and you're pitching an idea, if 50% of the people say you're crazy, and the other 50% of the people say, it might work, then that's kind of the sweet spot where you want to be, right? The delusional point where you're talking about, right? So if you're there, but you have to be able to prove or think, be able to make your case that technology could maybe just make this happen.
Okay.
You're not basing anything off of a lot of preliminary data. You're basing your decisions off of a little increment of data that came out of this lab and maybe something over in this lab. And if I pull this team together and form this team in a special way, I can achieve a transformational change. GPS is a good example of that. It came out of DARPA, right?
Okay.
Before that was Loran systems. You had radio antenna transponders on the coast, for maritime navigation and so on. And who would have thought, at the time, if you put a bunch of satellites up in the air, I can tell you where you are within 1 square foot, right? That's transformational change. And now it's in our phones and so on. It's everywhere. It's ubiquitous. That's a transformational aspect to it.
Right, well,
so when I was thinking about neuroscience and trying to think of brain-machine interfaces, what's transformational? And for the last 25 years, DARPA has been investing in neural interfaces in general, starting back like in 1999, which was focused at recovery of function. So people that were harmed on the battlefield, lost an arm, spinal cord injury, some sort of brain trauma, is it possible to integrate into the nervous system to recreate a capability that you might have lost? So, a lost arm, something like that.
Right.
When we look at, and it's been said in the field before, and I love the term, the brain is a data organ, right? And so when we're thinking about how do you interface to the brain in a way that's maybe beyond recovery of function, but how do you start, thinking about how do you, connecting to the brain that doesn't require surgery? And is there a way to do that? And is there technologies out there that allow you to interact with the brain beyond just our anthropomorphic, senses and capabilities?
Okay.
And that's what really spawned that whole program about non-invasive brain-machine interfaces. We're looking at light, we're looking at electric fields, we're looking at magnetic fields, nanoparticles. There's all kinds of different technologies that might have been able to achieve that.
Now, if I'm not mistaken, there's also work, maybe it's continuing, in terms of being able to control drones by thinking about it and directing it. Is that accurate?
Well, the question is, if you have a non-invasive brain-machine interface, so something, I go into work in the morning, I put something on, or maybe it's in the chair behind me, or whatever it is, whatever that connection is, you want to be able to use that in a way that can help you do your job or your mission better. And then at the end of the day, you go home and do whatever your day is, right? So it needs to be something that you engage with and disengage with, at will, and it needs to be able to help you perform something better than what you can do currently. Okay. And so the transformational piece about this is it even possible, right? We can think about how we might be able to use this device, but we haven't figured out how to build it yet. And so this whole program that I had started was really about trying to figure out what modalities could give us this ability, and at what resolution could we interface to the brain? Is it what we call mesoscale? Is it at a single millimeter? Is it something smaller? Is it single neuron? What's the level of interaction that's actually going to be needed in order to achieve certain types of interactions with other types of devices?
Okay. As I read up on your background and your different accomplishments, the words that kept coming up that helped you be successful was the idea of being really good at putting together interdisciplinary research environments. And I wonder if you can talk about what that actually means to have a really well-functioning environment like that.
Well, to me, you start with a great research objective, right? And everybody's got to believe that this is possible.
Okay.
And then make sure that they have the environment that's needed in order to carry out that research. So what I mean by that is the appropriate resources. So do they have the infrastructure, the equipment, all the things that are needed to explore this? Do you have the funding that's going to back it up? And do you have the best minds on that particular problem that you can get? And building that team and making sure that you have created that shell or that environment is the tricky part, right? And then once that's built, my experience has been just get out of the way, right?
Because your advice is get out of the way.
Yeah,
okay.
Once you build the environment, right?
Yep.
And if everybody believes that's on that team that we can achieve this, you can't. The energy that's created by creating that environment is huge, right?
Right.
If you get everybody rowing in the same direction to achieve that vision, upgrade reality, for example, right? If everybody's on that path, then to me, then the management's role is to stand back, buffer where you need, and let these guys or girls do what they need to do in order to be successful.
Okay.
And to be able to moderate when things go off the rail, because it's going to happen in research. It always happens, right? Or you'll discover, well, this isn't going to be possible, but we might be able to try this approach instead, and that might take another year and another $1 million. But somebody's got to be able to defend that, and somebody has to be able to put that in context and say, this research is still worthwhile going after. It's not what I expected 2 years ago, but it's still something we need to try and achieve.
Okay.
And that magic and that teamwork is really what I think makes things different. There's a lot of spheres of influence that you have to go through in order to move technology from basic all the way to translation. And that's the environment, I think, that really is helpful.
Okay. You're working now with NTT, and you're helping guide partnerships. Is that right?
Yeah, I'm the head of partner strategy.
Okay. What does that mean to be head of partner strategy? What's a partner, and what makes a good partner?
Yeah, to me, what was interesting when I came into NTT is there's these collaboration research agreements, right?
Okay.
It's not a contract, right? It is a contract per se, right? I guess legally, but it's not like a fee for service. It's not I'm going to pay you to develop something and then I'm going to get a deliverable 5 years from now or 2 years from now. It's a collaborative research environment. And so as Juan mentioned earlier, part of the model is an embedded model, where in many cases we have NTT employees on site at universities conducting the research. And a lot of that output, when you compare it to the different types of agreements that we have, they tend to be overperformers, right? Because you have the academic flair, but you have the industry requirement all happening in the same room. And as we go back and look across these agreements, that was glaring what came out of that these embedded approaches really are quite transformational.
So you're doing more of those kind of?
Well, that would be the idea, right?
Okay.
I mean, and as you mentioned, it's any time it always feels like there's the innovation, and in this case maybe an embedded model, and then there's policy and legal issues that go along with it, right? That always kind of like, how do we figure this out? But we got a great team within NTT to try and figure that out, and there are IP issues, there are who owns what when something's developed, and you happen to have an employee in a lab at an academic institution. Those things we can figure out.
Okay,
right?
Please, Juan.
And don't forget the benefits to the students and the academics
Absolutely.
at the university who watch an industrial scientist perform, and they learn from that.
Yeah.
It can be impressive.
A lot of the discussion we've had within the company is about it's not just about the science, but it's also creating a well-rounded employee, right?
Right.
And so how do you not only do you understand your field scientifically, but do you know how to work with teams? Do you know how to set program objectives? Do you know how to maybe go after external funds if that's something that you want to do? And how do you build that mentorship around maybe a new employee and put them in an embedded situation? It's really quite a fruitful environment.
Okay. I look and see we have about 13 minutes left, and I'm going to ask you a very unfair question because we could easily spend an hour on this topic. But I'm curious, as we think about basic research, what role AI and data science is playing and has the promise of playing, and what gets you excited as you think about what that's bringing to the table. Joe, can I start with you?
Yes, as I mentioned earlier, I'm kind of causally oriented. Physicians probably feel more comfortable if they understand the underlying mechanisms behind the performance of some kind of device. But as I also mentioned earlier, there are things that we cannot know in humans that we may discover in animals. And so we have to make some kind of inference. And I think that Biodigital Twin Center at the National Cardiovascular Center that will give us access to invasive studies in thousands of patients will provide the kind of data, big data, if you will, that can help us make reasonable predictions for parameters we may not be able to directly measure in humans. And so I think that's a big role for data science. As far as AI, my bias, and Al spoke to this in a past conversation, but my bias is that I believe AI can perform very well in everything that it has seen.
Okay.
But as a physician, then I need to somehow do a check on AI when I'm making use of it in some kind of a system. So I'm very strong on data science in general, with caution around AI. But I know that AI is evolving, and maybe there's something as a smarter AI that's on the horizon. But as a physician, knowing other physicians, I would rather know that the causal mechanisms when treating a patient.
Okay.
Yeah.
Is there something that concerns you about how it's progressing when it comes to your field?
There's nothing that concerns me. My focus just at this point, there's so much to do based on causal mechanisms that our group in particular has insights into, that's been my entire pursuit, with an eye toward applicability to fill in the gaps with AI and data science as far as possible. Data is critical. I mean, data tells you, it cuts both ways. It tells you that you chose something that's probably correct, and it tells you that all of those other things you thought were correct are absolutely not. And so I rely heavily on data. AI is just not my focus at the moment.
Okay, I got you. Juan, I know you pay a lot of attention to this. What are you thinking about the role of AI in data science in the field of basic research?
Well, I think it's a very exciting moment. One of the things that I'm most excited about is the ability to use AI to increase the throughput of research, to accelerate research.
Not to accelerate it.
Accelerate.
Okay.
Yeah, not substitute fundamental science and the way we try to understand problems, but accelerate what we do to do science faster. For example, you can have robots now generate a lot of data, much more than we could before using a person. And those robots are going to be driven by AI-based algorithms. The moment you generate all those data, you can learn a lot more, learn it faster, do better science. And again, go back to your fundamental science, to your background, to be able to advance knowledge. I think that's extraordinarily exciting. We find examples of that in the design of drugs, in the design of molecules, where AI plays a key role. But again, going back to what Joe was saying, it cannot substitute fundamental understanding of the causes for what we see in nature.
And do you see that it will play AI will play an increasingly large role?
Absolutely. There's, in my own laboratory, there's experiments that we used to do by hand. And now we have machines that are doing those experiments 1,000, 10,000 times faster.
Wow.
And it is all operated by AI.
Okay.
But at the end of the day, when we have those data, we go back to what we've always done, which is apply the rules of physics and chemistry to understand the data that we're actually collecting.
Okay. How about from your perspective, Al?
I think of it a couple different ways. One is like in my mind, when I think AI, I also think its connection to autonomous systems, and which isn't always necessary, right? But from my perspective, DARPA had a program called Explainable AI, and the concern was when you're thinking about, assume you're getting ready to target something, right? From a military perspective, you want to make sure you're right. And you want to make sure that if you're using some sort of AI engine to help you decide this, that you're going to get repeatable data, right? So does something happen within the AI itself that is not explainable? And because you're getting more and more deep layers with these types of things, how do you know what's really going on inside? And can you rely on the decision that comes out of that? And is there bias in there or not? Or and when you're thinking about lives, human lives, this is a big decision. And so I don't know where that part of the field is going. I'm a little bit concerned about that piece of it, and maybe even from the healthcare side. Joe and I were talking a little while ago about, when does the doc need to be in the loop and when does the doc not need to be in the loop, right? Do you trust that AI algorithm enough that it's going to make the right decision every time?
Right.
Or does the doc need to sit there and say, they're advised by the AI, but then they decide, yeah, this makes sense or it doesn't, and they click the green button or they click the red button, right? So when does it make sense to have human in the loop and human out of the loop? I think it's still a little bit left to be decided, and it depends on the severity of the application. right? I mean, there's systems now that don't include AI, but there are autonomous systems that kick in, and the human does not override it, right? Your anti-lock brake system, right? As soon as you decide you want to put on the brake, that system takes over to decide how to slow your car down in the most optimal way, right?
Good
You
analogy.
you can't override that, right? So we already assume that some of these autonomous systems can make better decisions than we make now, and we've already accepted that in many cases. But this is going to get more and more complicated, and how do we start pulling all of this together? It's going to be an interesting thing to watch.
Okay. I want to just ask one final question, and I think we talked about this at the beginning as being one of the inherent factors of basic research is that you're not going to be successful sometimes unless you fail. And I wonder, when you think about bringing a team together and guiding people, where and how does failure, embracing failure, working past failure fit into your work approach? Juan, I wonder if I can start with you.
Well, I think just failure is critical. It's a critical aspect of research. And if you're not failing often and repeatedly, you're not taking important enough risks. That's very clear.
Okay.
On the issue of failure, something that we haven't done very well, we haven't done it at all, is document failure so that everybody can share that.
Okay.
For example, when we publish papers, we only publish our best results, our best experiments.
Right.
And we ought to have a journal of
failure.
Failure,
Right.
failed data, wrong data.
Right.
Because there's so many lessons in those failed experiments.
Right.
So again, failure is very important, and I always tell my students, it is great that you're making mistakes as long as you find the mistakes.
Okay.
If you find that we're all okay, make as many as you want. But
okay, that's a good environment.
well, absolutely. I think we encourage failure as long as you correct things.
Okay. Al, does the government let you fail?
I try and change the definition. I just move the goalpost a little bit, and I mean that in a good way. There's a situation that I was in where, again, DARPA programs are moonshots, right?
Yep.
And so that's very, very hard to achieve the goal on a DARPA program. Matter of fact, it hardly never ever happens.
Okay.
But so define failure. Right? I mean, just because you didn't hit the metrics of that program, does that mean that your technology is a failure? Now, in some cases, you might base all of your technology, all your research on some ill-posed situation which would have never worked to begin with. Okay, fine. In that case, cut the funds, be done with it, and move on to the next idea.
Okay.
But a lot of times, there's things that happen oftentimes in research where it's, again, you didn't quite achieve the goal, but there's value there.
Absolutely.
Right? And that's what I mean by changing the goalpost a little bit. And so in some cases, and I was in situations where I had to cut funding to a team because they weren't making the metrics of the program that I set forward.
I see.
But they still were developing something quite important and useful in the neurotech world. So at that time, we decided, okay, well, let's keep the contract going long enough that you can align to some VCs and see whether or not you can get some other external funding coming in. And that was a win for everybody because it's a translation of technology for me to say, okay, we've got it this far. They didn't achieve the metrics of the DARPA program, but there's definitely a clinical use case for this technology, and let's move that forward.
Okay.
So it just depends, I think, on the angle that you look at it. And in most cases, research that I can think of across my 36 years in the government, very rarely was there ever a failure.
Okay.
You just that's, I think, where this evangelism comes in.
That's a good framing. That's a great framing.
Because you look at it a little differently.
Okay. How about from your perspective? How does this fit in?
As someone who loves physiology and biology and medicine, we routinely fail.
Okay.
And I think we generally celebrate complexity in the first place. Biological systems are complex. And how can you celebrate complexity without also celebrating even more failure? So failure is a common part of any biological studies, and especially when it comes to medicine. That's why in medicine you have differential diagnosis. You start saying what a thing is not, because you can't say what it is.
Okay.
So you start ruling out things. That's the expectation, in a way, for the possibility of failure. So I think my whole team doesn't necessarily, well, maybe the older members enjoy failure, but the younger members perhaps not. But failure is not a deterrent. It's something that we encourage, I think, to gain knowledge and insights.
Please.
And I think a related, very difficult question, I think, Al, you alluded to that, is to decide when you failed enough on a problem to just give up, stop it, and work on something else. You might be just around the corner of the answer,
right.
or not, the answer doesn't exist. And calling the shots there, and just deciding when to pull the plug.
Okay.
Very, very difficult.
Yeah.
Yeah.
We have covered an amazing amount of ground. I hope it was as engaging for all of you. Thank you guys. You guys have a wonderful way of explaining not only your own work, but the whole engaging and working in basic science. So thanks for coming and sharing that with us today.
Thanks so much, fellas. It's been a pleasure.
Thank you all.
Thank you, everybody.
Yeah. Thank you. It was great.
Thank you so much.
Thank you so much. Thank you.